This is American Thought Leaders, and I'm Yanya Killick. Right now I'm sitting down with Ed Hudgins, Research Director at the Heartland Institute. We love having folks from Heartland. We've been covering a lot of your material and so forth. So, one of the big pieces that I know that you've been talking about is over-regulation in the drug industry. So I want to cover that in a sec. But first, tell me, we're here at CPAC, a lot of energy. What brings you here?
Well, I've been going to CPAC for many, many years. I worked at the Heritage Foundation. I've worked at the Cato Institute, the Atlas Society. I was in Atlas Shrugged. And the thing about CPAC is it's a gathering of like-minded individuals. And I use that word mind because a lot of the left is, we don't want to think about it, we just want the narrative. Here, people are thinking. People are trying to understand how we can change the world for the better, exchanging information, learning new things. And the nice thing is that they're going to go back to wherever they are. I'm in the DC area, but a lot of people are going to go back to Missouri, to Illinois, to Arizona, to all of these places, armed not only with more information and knowledge, but the enthusiasm that we don't have to accept all the problems of this country that have been going on for decades, that we can make a difference. And CPAC allows for exactly that sort of community and activism.
We very much have the same sense. I love hearing you keep coming back. How many years have you been going again?
Oh, I can't count them. It was going back to maybe the late 80s or early 90s.
And you feel that spirit's been there, imbued all the way through.
Yeah, and again, it's made a difference too, because as you could look at particular policy changes and so forth, you could say, yeah, well, they were really talking about that at CPAC back in this year or that year. So I encourage people to come to CPAC. It's a great experience.
So, there's a few issues that you're particularly passionate about, and I know basically the way the laws are structured or policies for the drug industry at the moment is something that you're not too thrilled with. Maybe you can give us a bit of an overview.
Sure, yeah. Well, here's the thing. Everybody, unfortunately, in our world faces illnesses. Whether everything from Alzheimer's, something like 5 million Americans have Alzheimer's, 100,000 Americans die each year of Alzheimer's, AIDS, cancer, you name it. The Food and Drug Administration in this country was set up, and it's gained power over the years. It has to certify the safety and the efficacy of new products. You can't market a new drug unless it goes through the Food and Drug Administration. Here's the problem. We all want safe drugs. We all want drugs that work, but we need them in a timely manner, and we need them in a cost-effective manner. In the 1980s and 90s, the Food and Drug Administration was under a lot of pressure to change because the AIDS epidemic was exploding. 50,000 people were dying each year of AIDS. That's almost as many as died in the whole Vietnam War. And they were saying, hey, we can't wait 2, 3, 4, 10 years for the FDA to approve a medication because we're going to be dead. So activists went out and basically forced the FDA to come up with a way of at least expediting approval of AIDS drugs.
Right.
But we have the same problem now. Today, on average, to go from a research lab to your pharmacy or your doctor's office takes 10 to 12 years, and it costs $2.6 billion. So you wonder why our drug costs so high.
I find that hard to believe. That's unbelievable.
That was a Tufts University Tufts Center study that came out just a couple of years ago, and a lot of the problem is the approval process.
But this isn't for people's safety?
The thing is, safety testing usually takes a very short period of time, a year or so, maybe. Okay, it's the so-called efficacy tests, phase 2 and 3 tests, that test, does it work? How well does it work? What are the doses and all? And that's important information. But if it doesn't come quickly, you're suffering, your mom or dad is suffering from Alzheimer's and going to die of Alzheimer's, and you're sitting there saying, well, where is it? And the FDA says, well, we have another test. We just think, that's not good enough.
Right.
So what we suggest at the Heartland Institute, this is kind of modeling off of what happens during the AIDS epidemic, is a free-to-choose medicine model.
Okay.
Here's what happens. After a new drug, It goes through safety tests, so we know you're not going to die from taking it, and at least one efficacy test, meaning that, okay, we have some idea this is a promising drug. Then the drug sponsor, manufacturer, can either keep it in the normal FDA track, or they could put it on the free to choose medicine track. On that track, and any medication can go on there, you in consultation with your doctor can take a look at that medicine, and if you want to try it, even though it's not gone through all the tests for efficacy, you're allowed to do that. The manufacturer can charge for that, so this helps a lot of the small labs that have innovative stuff, can't afford $2.6 billion. So now they can at least charge, maybe your insurance company would cover it, so you get to try it. And here's the other thing. You're getting real-world data on how that drug behaves.
Of course.
Normally they go through clinical trials, and you have a group that takes the drug and a group that doesn't take the drug, and they don't know who does what, and you monitor them. That's fine. But this is a way of getting real-world data flowing in. It has to go in a database, and your privacy is protected. But that means a doctor, a patient, anyone can look at that database, older than younger.
I mean, basically you're saying you do the testing on people who are willing to be part of that process because they want to try something. They're willing to take some risk.
Exactly, and this comes, by the way, this whole thing.
But you're saying the safety testing's already been done?
Already been done, and at least one efficacy test, so we know it's promising. Because think of it as this, think of the database as a Yelp for medicine. Everyone knows what Yelp is, right? And it's kind of that sort of thing. And this whole thing came, by the way, this whole idea came in part because we saw, for example, here in the Washington, D.C. area where we are at the moment, okay, back in, I think it was 2000, little girl, 20 years old, had neck cancer. And she tried the normal treatments. By March of 2001, nothing was working. There was an experimental drug still being tested, and she wanted to get access to it. Her father and her went on television, local TV. They tried to pull strings and so forth. They couldn't get access because it was still in tests. If the manufacturer had given it to her and she died, well, that's a strike against the manufacturer. After all that effort, she died in June of 2001. The product was approved a month or two later.
Oh boy.
I can give you a whole lot of examples like that. And that's one of the reasons why we have this. Here's something very interesting. Right now, we're on the cusp of a medical revolution, okay? For example, to sequence a human genome, meaning to know everything about you and what might work or might not work in terms of your medication. In 2001, it cost $100 million. In 2007, it cost $10 million. A couple of years ago, it cost $1,000. Yesterday in the paper, there's a story about a CEO of a company who says he's going to probably get it down to $100 in the next year or so. Meaning that we can get all the detailed information to you, and we can cure you. Not everyone out here, but you. Tailor the medicine to you. All of these exciting things are happening. Again, we have an exciting way, the Free to Choose Medicine Project. You can read about it on our website at the Heartland Institute.
Fantastic.
And so if you want to live to 200, if you don't want to see yourself or your parents or your children or your wife or husband suffering, take a look at this way of expediting medications so we can all live long, long, healthy lives.
Edward, thank you very much. I appreciate your time, and I'll see you around at CPAC.
Sounds good. Thank you very much.
Thank you.